Meningitis is an inflammation of the lining of the brain and spinal cord that can cause deafness, brain injury, and even death. You need a medical test to determine which type. There are two main types of meningitis, viral and bacterial. Viral meningitis is the most common but the least serious. Antibiotics have no effect, and most people heal without treatment. Bacterial meningitis is rare, and you need immediate treatment of antibiotics and corticosteroids in order to prevent further damage. Signs and symptoms in adults and children include severe headache, vomiting, nick stiffness and joint pain, a rash that looks like tiny red or purple spots or bruises, high temperature, sensitivity to bright lights, drowsiness, confusion, or seizures. Symptoms in infants include being difficult to wake, being fussy, vomiting, pale or blotchy skin, high temperature, loss of appetite, moaning or a high-pitched cry, and the rash of tiny red or purple spots or bruises. Meningitis can spread through direct and indirect contact. An example of direct contact would be kissing, sneezing, coughing, or through saliva. An indirect route would be interacting with an object a person infected with meningitis has used.
Ottawa Public Health regulations regarding meningitis. All cases of meningitis must be reported to Ottawa Health by the next business day, but bacterial meningitis must be reported immediately regardless of time. Ottawa Health will decide on a case-by-case basis who will be excluded from the program. Exclusion depends on what kind of meningitis is contracted, with bacterial meningitis usually being excluded. While exclusion may not be required for other types of meningitis, a child's symptoms may prevent them from participating in the program otherwise. There is also a reporting form to fill out and be sent to the Communicable Disease Control Program of Ottawa. This form includes patient info, treatment info, disease info, and physician info.
In order to prevent a viral meningitis infection, the center would be rigorous about making sure all children and staff follow the proper hand washing routine before and after eating, after coming in from outside, and after using the toilet or changing a diaper. The staff would also be very strict about cleaning and sanitizing toys, as well as any surfaces in the environment at the end of each day. In order to prevent a bacterial meningitis infection, staff would enforce proper hand washing routines and sanitizing of toys and surfaces in the environment after each use or after they have been in a child's mouth. There are also several immunizations against meningitis that most children receive as a routine precaution. The Child Care Center may have rules ensuring that all children in the center have their immunizations up to date. There are no fail-safe methods of prevention, as children who are infected with either of these diseases are contagious before they even begin to demonstrate symptoms. A commitment to rigorous hygiene practices and an updated immunization schedule are the only clear-cut preventative measures. If a child became infected, the staff would contact the parents and let them know the symptoms their child has been exhibiting and what they expect it might be. They would recommend that the child sees a doctor immediately to determine which type, viral or bacterial, the infection may be. Once the child is diagnosed, some centers will allow a child with viral meningitis to continue to participate in the daily routine, as long as they feel up to it. Viral meningitis is often seen as similar to the flu. If the child is diagnosed with bacterial meningitis, they must be excluded from the program until 24 hours after the antibiotics have been administered. Anyone who might be considered a close contact, meaning the other children or staff in the room with the infected child, might be offered antibiotics as a precaution. Sometimes the center staff will liaise with the child's doctors to remain abreast of the situation, and often they will send a letter home with parents detailing the incident and giving some extra information on meningitis. Staff will be extra vigilant for further signs and symptoms from other children in the room, although a secondary outbreak is typically rare.
Parent and caregiver information. If you suspect that your child has meningitis, call your family doctor or go to the emergency room immediately. Your child may be treated with antibiotics depending on the strain of meningitis. Be sure to administer the medication as it is prescribed. Be sure to wash your hands and cover your mouth when coughing or sneezing. Clean and sanitize any toys or surfaces that could possibly be contaminated. Make sure your child does not share items with other children, especially if they could have saliva on them. Be sure to get your child vaccinated against meningococcal disease when they are of age. Depending on the strain of meningitis, your doctor may treat those who have been in close contact with the infected person by prescribing antibiotics. This is typical for bacterial meningitis.